Hello, ladies and gentlemen. Thank you for joining this edition of the Cameroon Town Hall for Healthcare Professionals. Once again, you're all welcome. We are having already 16 people that have joined, and we hope many people are going to join us for this very special edition. Ladies and gentlemen, if you are joining in for the first time, this is the Cameroon Town Hall for Healthcare Professionals. We meet every fortnight to discuss on health issues that concern our country and see how we can contribute to ameliorate the health system of Cameroon. Today is going to be a very special edition. We are going to be having a conversation to revisit, some of the good things that have happened in the town hall. And we have today those who were appointed in the work group that was created by the Minister of Health in the Ministry of Public Health in charge of diaspora activity. We are aware that they had their first meeting, and we want to hear from them some of the things that were discussed in this meeting and how this group is going to help all Cameroonian diaspora who are healthcare professionals to see how they can easily contribute to the healthcare system of Cameroon. Before we get into it, let's get a round of the moderators that are going to co-moderate the session with me, and I would want to start by welcoming Dr. Brian. Hello, Brian.
Yeah, hi, Elvis. It's always really great to see you and to join every session of the town hall. I think today it's really important session. I think that and Elvis, you would agree with me. There's an enormous talent in the diaspora. There are people with expertise in diverse areas. In medicine, in healthcare, in public health, in laboratory science, in biomedicine. I think we're doing really amazing things in the diaspora and helping other countries, but not a lot of those we see in Cameroon, right? So I think what the ministry has done is really really innovative. I think it will really help to accelerate some of these things and make it a lot easier. So I'm really looking forward to how this working group that has been created would work together to leverage some of these challenges that Cameroonians in the diaspora have historically faced in terms of creating impact locally. So I'm very excited about this. I congratulate the members of the working group, and I'm looking forward to their comments today.
Really true, Brian. A really group of diverse people. We have all kinds of skills in the town hall: surgeons, cardiovascular surgeons. We have researchers, and even people that are not in healthcare, but that are already developing a keen interest in how they can invest in healthcare in Cameroon. So this is really an amazing initiative. And people ask me, Brian, how have you guys done this? And even those from other countries, have you guys succeeded to do this kind of a work? Have you succeeded to bring in 2,100 and something people on a platform from different countries? And I said it's just because of the interest that all those who have joined this town hall today have shown over the years that we've been together. So it's really exciting that we are at this level thinking about just how we can contribute and give back home. And today we have Dr. Kenne, who is also going to co-moderate. Welcome, Kenne. You're mute.
Yeah, I don't know if you can hear me. I'm having a bit of a challenge this side today, but okay, great. Yes, so really, thank you, Elvis. So apologies, I'm joining 5 minutes late, as I said, but really looking forward to this session. Just really to give us an idea of what has been happening, I think within the past 2 or 3 weeks with regards to the Ministry of Health and discussing with the diaspora, and things are happening in a very rather fast scale. And so I think with this session, we are going to have highlights, of all these formidable things that have been happening behind the scene, behind the ground. And certainly we are going to also get points, and pointers of things that we can move forward, the discussion between the Ministry of Health and the Cameroonian Diaspora. So looking forward to the discussions and the presentations.
Yes, Kenne, and you would imagine that the interministerial committee, the committee that has been formed is made up of people from other ministries. It's interesting to know that we had somebody from the external relation who is a member of the committee and took part in that meeting. And this comes to answer some of the questions that were raised when the minister was guest in the town hall about how to make it easy for Cameroonian diasporans who are having another nationality to easily get visa to go back home and help contribute in the healthcare system. So lots of those things we shall be discussing today. And let's get to Dr. Christelle. Hello, Christelle. Do we have Christelle yet?
I think Christelle will be okay.
Yeah, I think Christelle will be joining a little later.
Yeah.
And I emphasize one last thing I kind of forgot. I really hope this serves as a model for other African countries. You did mention that you know, others have reached out to you asking how this initiative has been so successful. I have personally received lots of similar messages as well, how we've been able to do this. But I think I'm really hopeful that this would serve as a springboard and as a model that I think other African countries can model through or by, and hopefully we will be able to sort of contribute towards building better healthcare systems and you know, leveraging the diaspora and stuff, and really helping to build better healthcare systems and public health systems and things like that in our home country. So I think it's a really great example. You just mentioned this about others reaching out to you, and it just reminded me about the other people who have from other countries who have reached out to me as well, asking about how this has been maintained, and really exciting.
Yeah, really exciting, Brian. And it comes to almost like change the narrative, right? In the past, we've always just been told about brain drain about all those who've gone out, but we're trying to change it now to say this was not a brain drain, but a brain train. It can only be brain drain if we only give back to the countries where we belong. But once we start thinking about home, going home to make things better, and then it was a brain train, not brain drain. So it's really great. And thank you, ladies and gentlemen, once again for joining the town hall of today. It's going to be a very exciting session. I would want to hand over the microphone to our chair to welcome you as well. Hello, Mona.
Oh, Elvis, thank you very much. And thanks to all the moderators for always doing a wonderful job. Yeah, it's very exciting, as you said. And I like your last statement, brain train. And it's important for us, the diaspora, to know that we have our place back home where we can go back and collaborate with those who are back home. I always love to use the word collaborate. There are a lot of diasporans that are already doing that, and we want to facilitate this in Cameroon and in Africa overall. We should not be received with steric hindrance and trying to protect us from helping and developing and collaborating with our colleagues back home. I think it's something that we need to get to. And also those who are back home should be able to embrace the diaspora and be able to teach the diaspora and also learn from the diaspora in the field of healthcare and in other fields. So I think healthcare is actually, we are trying to show the way forward. And it's usually always a blessing that the town hall still keeps running. I think this is 3 going to 4 years, and we'll keep doing what we're doing. And the reason why it's sustainable is because I think you all who are participating are doing a wonderful job. So Elvis, over to you. And I think you'll come back to me and I'll tell you exactly what happened. And I and Dr. Sammuel were here today. The other members would join us as the session goes ahead.
Great. And the other members, I can see Professor Ngacho is here already. Dr. Sammuel is here. Gladys is going to join us. And I think we're going to have all of those who are appointed on this platform. And guess what? Just to put it into perspective, when they say a work group has been created in the ministry, it's not just maybe a committee that has just been created in the air. It took quite some administrative procedure and decision for this to happen. A text of creation was drafted, forwarded to the Prime Ministry for review, sent back to the Ministry of Health for validation, and all went through the normal procedural steps that are needed to create such an important and recognized organ in the Ministry of Public Health that has really some functional staff attached to it to make this work. And so before that text was created, I just want to say that it took a lot of the minister's willingness and decision to put a team to work on the term of reference for this important organ in the Ministry of Public Health that is going to really play a major role in just streamlining the activities of the diaspora. I'm happy that we have those who were appointed on this platform. Before I hand the floor over to Dr. Muno to start by just giving us a brief of what the first meeting was like, we are going to make it a conversation, as I mentioned, but permit me officially just take a round of all those who were appointed on this to serve on this committee on behalf of diaspora to say a word of welcome to you, so you can first know them, see them before we open the conversation. Let's start with Dr. Sammuel. Dr. Sammuel, you've been very instrumental from the first day you were appointed. It seems as if you are the one who conceived the idea from the way you have really been articulating in this work group and really making sure that things work well. I'll give you the floor to say hello to the town hall.
Thank you, Dr. Elvis. Hello, everyone. I said the town hall, the formation of the working group is one of the greatest achievement of the town hall. I remember the first time I talked with our chair, Dr. Mono, and he was asking in what ways can we contribute? And I say, having a platform like the town hall, it is the best place for all of us in the health field to come together. And I will actually quote that I was in a meeting with Dr. John Black. I think he is from Kenya. And he was talking to the Clinton Foundation because they have a research going on in Uganda, in Rwanda. And his point is that there are many of such research and many things happening. And sometimes we tend to duplicate and we waste resources. And I think about that and I said, with the town hall, giving us that platform, the opportunity to share what we're doing, listen from other professionals. And that is why we are actually where we are now, because without the town hall, I don't think the Minister of Public Health would have had the opportunity to address us. And not only addressing us, making a promise and keeping to his promise. So I just say, I am so excited to be part of the town hall, and I always make sure when I make my programs, I do everything to at least attend the town hall. And I'm looking forward to share. And I want to thank again the town hall and everyone for giving me the opportunity, and also recognizing the minister for giving me the opportunity, and all of us that are members in that working group, that I will do my best to serve you. We are representing all of you in this town hall and other healthcare professionals who are not even part of this town hall. And I say we will be useless if we don't hear from you. Because if we are representing you, we are here to listen and to be able to take it to the table and speak on your behalf. So thank you again.
Yeah, thank you so much, Dr. Sammuel, for those words. I'll hand over to Professor Gacho. Hello, Prof.
I'm not sure Prof has joined yet.
Oh, he's not joined yet?
Oh, yeah, Prof has some surgeries today, so he has some colonoscopies and EGDs that was programmed, so he's going to join later.
Okay, then do we have Gladys? Hello, Gladys. I know she was also supposed to be on the having some patients primary care this morning.
Yeah, Gladys is going to join later.
So Gladys was on. I saw her. She was actually on. Maybe she's at work, but she actually joined.
Okay, great. Well, hopefully they are going to join us. And so let me just hand over the floor to Muno to take us through what the first meeting was. And I think part of it will be also discussed by Dr. Sammuel. Let's listen to them.
Yeah, so I'm just going to talk about the working group, and Dr. Sammuel was our rapporteur. He would give a brief discussion about what we discussed and the highlights of the meeting. So I would share a little slide just to start my little presentation. It's important that we get to realize this slide was created deliberately to show that as a diasporas, we need to think about Africa. No matter your field of interest, be it in engineering, in medicine, in nursing, we need to collaborate with Africa, learn from those who are back home, and also share our experience with those who are back home, because it's a two-way traffic street. It's not a one-way traffic street, where we go in, we learn, and we collaborate. And there are a lot of diasporans who have financial capabilities to actually move the country forward. They should not shy away, and we should create an environment where they can give back. So the hands together is really more of a collaboration, and diasporas coming to Cameroon is a time to come back. This is one of my most favorite quotes of all time by J.F. Kennedy. He had multiple that I really love. And it's really about asking not what your country can do for you. We ask that all the time. All the forums I've joined, that is the question. What can my country do for me? All the discussion really surface around that. I think the discussion should start being put forward, asking what can we do for our country? What are the opportunities that we can get change to happen in our country as individuals, as groups, as medical associations, nursing associations abroad, public health associations, engineering associations? What can we do as individuals, as groups in Cameroon in order to make things better? Even as a town hall that we are here, the town hall really is a group of lovers of Cameroon in the diaspora and those back at home who want change in the healthcare sector, who want change. And this platform is open to everyone at any time who wants to talk about any interesting topic back home. So the members that were part of this discussion group, if you see, I'm not going to go through all the different directors were represented in the Ministry of Public Health. And also the Ministry of External Relations was there in this discussion, and in the creation of this text, the Prime Ministry was involved. It's important that we know that our rapporteur here is Dr. Sammuel. He's impeccable. I'll tell you that in advocating and really what I call understanding how to do the politicking back home and get things done for the diaspora. I would want to thank Sammuel particularly for his time, his dedication and devotion. We also have Gladys, who is also going to join us soon. There is Professor Theodore Gacher, and there is myself who was there. Initially, I think I was not supposed to be a member. We're waiting for representatives from France and Germany, and the minister had to go ahead and create this group because we could not keep waiting. So I think one of the things during our meeting, we did advocate for the minister to still give time for us to send them the names for those who represent Germany and those who represent France, because we're choosing hubs that have huge amount of Cameroonians living there and who have huge amount of healthcare workers who do make change back home. We do not want to allow any region to be left out. As soon as we identify a region, we're going to advocate for them to be represented. So from the UK, and also Professor Theodore was actually a representative from there, and then from North America and all of that. I came in just because I was a chair of the town hall and a representative. So our rapporteurs, actually there are three of them, but I would lay emphasis that Sammuel is our rapporteur and has done a wonderful job in making the ministry also responsible, getting out recommendations immediately after the meetings and actually making them to become actionable so that we can move forward. Now, in creating this text, I'm just going to talk about the goals, then I'll let Sammuel talk about the other things that happened. The goals were really to define the area of involvement of the diaspora, the Cameroonian diaspora in the field of healthcare. Where can we get action done? These goals were actually made alongside with correspondence between the members and the ministry. Also to establish a mechanism for support and professional integration within Cameroon's healthcare system by the Cameroon medical professionals living abroad. Where can we help? Is it in training? Is it in infrastructure? Is it in providing professional help? We do know we have very little or very few amounts of, let's say, cardiothoracic surgeons operating in Cameroon. Rather than bringing, let's say, all the time carrying white professionals from Cameroon and coming and worshiping them, there are multiple Cameroonians who are cardiothoracic surgeons also in the diaspora. There are multiple of them who are trained in Cameroon and moved to the diaspora. Can they come back? Can they be given the same privileges, the way we give it to the whites who move into Cameroon and just do things, where we can do sustainable actions and get things done? So promoting and facilitating the implementation of diasporan initiative across the entire nation and the territory. We have seen this happen. Dr. Sammuel is an example of someone who has done wonders in DAP, has a huge philanthropic center where he takes care of thousands of patients every year. And his wife is doing the same when it comes to helping women also there. And there are multiple other projects that are going on. Can the ministry really facilitate this for us? Can we create an environment where registering these projects will be given special priority by the ministry? Developing mechanisms of recognition and valuing high impact initiatives from the diaspora within the healthcare system. How does the ministry know what kind of impact the project is going to cause? And how can they make this projects not provide more of initials to some of these projects, but facilitate these projects to develop quickly? Also, coordinating and monitoring the implementation of diasporan activities in the field of healthcare. As diasporans, no matter how much activity we do, if we cannot coordinate it, monitor it, and show that this is the impact we're actually creating, it becomes a whole huge problem. Also, planning annual activities and reviewing and adopting annual activity programs. These are all things that we put in the goals. Monitoring the implementation of multi-year plans and operational plans within the diaspora, and consolidating decisions made and transmitting them to decision makers and also to you guys who are in the diaspora, and proposing creation of ad hoc committees to address these issues. We're here to listen to you, get your proposals of how you want this to go forward, and be able to put, there is no way you can bring change if you cannot sit on the table where decisions are made. If you're out of the table where decisions are made, trust me, you're going to not go anywhere forward. And I think finally, the committee is also responsible for providing opinions on all matters submitted by the Ministry of Public Health, meaning that if the ministry feels that there is some decision, we brought up several things that they did not consider, we'll be able to at least talk about it. So I would like to say that these goals were created. Our goal is to make sure that they become actionable plans. And I would pass over the mic to my colleague and friend, Dr. Sammuel, to continue with the rest of the discussion. I don't know if Sammuel has any presentation, but we could always talk. Let me stop sharing.
Thank you very much. Yes, I do have, I put some few slides together, and I really appreciate this opportunity. And before I even go on, Elvis said brain train. And I was just thinking about my discussion during last week with Mono. If you remember, you can see the importance that through the town hall we are connected. I had a phone call from one of the doctors back home. They had a pregnant woman with twins and hepatitis B positive. The immunoglobulin that they have was the polyvalent, and they were in a situation where they didn't know what to do. And I got the text message. I passed the message directly to Mono, and he screenshot immediately a table with guidelines on what to do. And that's the importance right there of why we are here. They were in a situation where nobody could agree. They didn't know what to do. So it is very, very helpful that once we are connected back home, and especially through a platform, it will be very, very helpful for us to be able to contribute, and will not just be in a random form, just like what happened with us last week. So we had a meeting July 27th, and at the end of the meeting, we had very, very important recommendations, which I want to just share my screen. And some of the recommendation, I don't know if you can see my screen. I just put it on there before I will show my PowerPoint.
Yes, we can see your screen.
This is just the raw report. And if you look on that screen, what I will be talking on when I put the PowerPoint was the ministry with the work I want to, again, Elvis is on the background. What he is doing, it is very, very important that we should recognize. If you look at what Mono just presented, our chair, that's the background work that they did long time before the working group was created. And I just want again to say thank you to all the moderators. Thank you to everyone that has been working with the town hall. And I believe that it is through that background working, which the chair now we're talking about, that we have to lobby. There's a lot of work that we do on the background, that the creation of the platform, which is known as Diaspora Minsante, or the Diaspora Minsante, is very, very important. I want us to take note of that. And that's why we focus more on that. And through this platform, there will be proposals of a working template. If you're going to do something back in Cameroon, how can you do it? We have to do it in an orderly manner. And that working templates, the working group will be the one doing those work. And also the other recommendations will be coming from us, the diaspora. We are going to work together to see how we can put together everybody in diaspora thinking to work in Cameroon. If you have projects, if you are on this town hall today and you are thinking of any project, of course, you can reach any of us, especially Elvis. If you get to him, you know, he is our really technocrat and the genius behind everything. He will be able to guide you and to direct you on how these projects can be channeled through this new platform. Through this working group, we do have pilot projects, and this pilot project will actually help many others to be able to see how things are working. I wanted to, let me get to my slide here and then put it in the slide mode so that, just give me a minute to put this in a slide form. So if you can see on the screen, the platform, which I believe it is the key in everything that we will be doing, as the working group will continue to work, coming up August 23rd to the 25th, there have been a workshop set up, and the workshop that is set up will discuss the details about how this platform will work. And I just wanted to share a summary of the platform here. I was just putting together some of the things that the platform, when you get to the platform, it has objective, what we are going to be doing, and it also specifies specifically the expected outcome of the work that the diasporans and the Ministry of Health, what our achievement. We heard the plan, we heard the Mano mention all the details, and I will say here to emphasize again that if you have any issues, if you go on the point by point of what our chair of the town hall gave, even though he said some of them are not there, if we can achieve what is mentioned in that plan, in that objective, I think we will make the greatest change. It's been a long time. We have been talking a lot, I mean, us in diaspora. And I believe that all the ideas that we have, if we can use this opportunity to be part of the town hall, to be part of helping the working group, we will, at the end of the day, when you look at the timelines of all the activities that have been enumerated, we will make a huge difference. So if you look at the background, we haven't gone through all the translation. The platform, the goal would be the implementation of recommendations of the previous discussion. Just like I mentioned, the town hall has already been working with the Ministry of Public Health for a while now, and there have been multiple recommendations that have been put together. And also the Ministry of Public Health, under the leadership of His Excellency, Dr. Manawuda Malachi, has come up with this theme. And that theme is important for us to know that this is the time to act. And this is the time to act. He is also considering the importance of diaspora in making a change, in building a new health system in Cameroon. And that will involve not only the Ministry of Public Health, it will involve all those working in the different sectors in the Cameroon health, in the Cameroon ministry, in all different ministries. So the objective of this platform that is being put together will capitalize on the potential of Cameroonians' human resources in all health sectors, including those of us trained abroad. And that is where the word you will hear me use this word by Elvis, that is not brain drained, but brain trained. So now you can see our government is looking to tap into all that skills, all the competencies of all of us in diaspora. And the belief is that, I mean, this number here of health experts, that number is very small. I think the objective here is, if at the end of the day, you can have even 1,000 of the health professionals who are in diaspora, that will be a huge change for our country. And the platform will promote projects, diaspora projects. If you have any project, know that this platform will help you. You will just need, as we work, the guidelines will be defined on how you will be part of it. And you will actually see that there is a sketch on how the platform will look. I mean, I put both the French version of it, of what the name is Diaspora Santé Cameroon. And in that platform, you will have enrollment of members of health professionals in diaspora, and there will be a membership directory. And it will be a two-way publication. We will be sharing projects. Those in Cameroon will have projects, us in diaspora, and the Ministry of Public Health and the Ministry of External Relations, as you heard, will actually accompany us. The person that attended the first meeting, she is the Director of Diaspora. I was talking with the chair of the town hall that when I met with the Minister of External Relations, I didn't even know that there is a Director of Diaspora. And so now the Ministry of External Relations has chosen the Director of Diaspora to be a member of this working group. So which means when we get to Cameroon, both the Ministry of External Relations and the Ministry of Public Health will accompany us. That's one of the greatest achievements. And so everything on that platform, we also have a way of us to communicate. This is this era of social media. So we'll be able, you can go on that website when it will finally be functional. You can put your recommendation on there, you can chat, there will be people live on there. If you have research, I remember Dr. Kate, they are talking about research as in the last meeting. So you have research and you want to share on those publications. This platform will give an opportunity for you to share what you are doing back home. By sharing, it will help us avoid duplications. If I am doing a particular research, I might not even know Dr. Kate is doing that same research. By us understanding what A is doing and what B is doing, we can put our resources together and it will help us move forward and make a change. So I put this here just to say, once the platform is up and functioning, and if you have an idea, you want to go back home to make a change, you will go through this platform and you will be registered. And at the end, you will have a card that will look the same like this. And if your project is in Chang or your project is in Yaoundé, in Soua, they will actually know before you get there, because this platform will connect you with the people on the ground. You might be going to Boya to do something in the city of Boya. The platform will connect you with the city council. The platform will connect you with the governor and everybody, and you will be well received on the ground. And of course, we don't just want everybody to walk into Cameroon and say, I'm a surgeon. Who knows that you are a surgeon? How can we vet you? This is the best thing for us, because we will actually work in a controlled fashion, and it will be the best thing that will happen for all of us. So I wanted to end here to say, I think we have come to a point, if you can see this slide, I'm not putting it, I use this all the time when I do my presentation. I learned this from one of the greatest leaders in the world, not just a greatest leader in Africa, that you cannot have an impact in society if you have not changed yourself. And humility is one of the most important qualities which you must have, because if you are humble, if you make people realize that you are not a threat to them, the people will embrace you, they will listen to you. Why am I bringing this? It's good for this platform, not even at the parking lot for me to share this. We should know that for the longest time, us in diaspora, back home, they know us as always criticizing. And this, what I'm sharing here is that let us change our approach to make our leaders back home know that we are part to contribute. We are not an enemy to them. We are coming in for us to work together. And how can we do this? If you humble yourself, anywhere, everybody will listen to you. And I have this here, that this, I believe, instead of criticizing others, we should be quiet and listen. Instead of complaining, make a suggestion. Instead of looking for a culprit, find a solution. Instead of playing the victim game, you should strive to become a winner. Instead of justifying your mistake, learn from others. And the last point, and then I could give over to the moderators, instead of judging others, judge your own attitude. If we all do this, I believe we have the best time for us to actually contribute. And we cannot, if you cannot follow, you cannot be a leader. So I believe that not all of us will be moderators, but we can contribute. You might say, I don't have the opportunity to do what I want to do. If you just ask a question, that question might lead to you doing something. And I want to thank you for listening. And I believe that we are up to something, and I want to give the floor back to the moderators and the chair to take over from here. Thank you.
Wow. Thank you very much, Dr. Sammuel, for the excellent presentation. I think your last slides is really, really touching, because I remember when Muno and I had this conversation some time back at the very onset of the town hall, that how do we want the structure of the town hall to be like each time there is a presentation. And that thought, that the mindset about, instead of complaining, make a suggestion, was the foundation behind how we structured the presentation of the town hall. So that each time you are doing a presentation, you want to talk about what is the gold standard. You want to talk about what is it that is done back home, and you want to talk about how can things be done better. And that approach was because of just that important statement you made, because we thought that if we make a town hall a bunch of complainers, then at the end, we would not have been here. All our complaints would have been finished by now, right? And we'll still be angry people. And we thought that instead of looking for culprits, because the culprits are always there, many, if you find them mentally, they are even here sometimes right beside you. But instead of looking for them, let's look for solution. And I think that's what all of you in the town hall have been doing. All the fervent participants of the town hall come here because they want to make suggestions. In as much as we might find cracks in the system, we always ask ourselves, how can we mend this crack? And that's a foundation of the town hall, and that's why we all are here. And I can see that Dr. Ngacho, Professor Ngacho is already here. If he has some availability, I know he's very busy. Maybe it's time to also hear his contribution still in relation to the meeting that took place.
Elvis, thank you very much. I must say, I just joined to see Dr. Ndinjiakat's last slide, and I think it's very insightful. I don't have much to add because I think he has said everything that I would have liked to say. And very importantly is how do we contribute rather than how do we criticize? I think that's a very important information.
Great. That's very great. I know it would interest you to know that all those who were chosen, maybe, I don't know if it was coincidence, are doing very great things back home. Professor Ngacho has a very big health program in Cameroon, Premier Health Services. If you don't know, you can find out about it. It's really an amazing state-of-the-art infrastructure that hosts a lot of different healthcare programs. And I think this is the kind of contribution that we are talking about when diaspora decides to go home to make an impact. Thank you so much, Prof, for accepting the appointment and for serving for already, making your impact in the meeting and the work group. So we are really appreciative. I think we are going to really have this conversation, and we are going to have a moment, which I think Brian is going to contribute to moderate, which will deal with suggestions from the audience on what they think this work group should pay attention to. But I always would say, don't expect too much from a group that has just been put in place to help, because I already have received a lot of emails from people saying that the working group should calls for employment of nurses, calls for this to happen. There are things the work group can do. There are things the work group can only suggest, and there are things the work group cannot do. So when we think about, when we come to the point of talking about suggestions of what we think the work group should consider, please pay attention to the fact that the objectives Muno listed is like the guiding, the guidelines of what the work group is expected to do. So at this point in time, I would want us to still get back to some few things you have to know about the work group. First of all, in the text of creation, members of this working group has as a mandate a 2-year term of office. Am I correct? Good. So
yes,
yes, you're correct.
So it is expected that after 2 years, they're going to be reappointment. Some can be reappointed, or some other members, if some members find that they are not going to have availability, others can be appointed to serve in this office. Now, let's go back to some of the points that Dr. Sammuel mentioned. You also the carte santé that he mentioned. I want to get back to Mono. If you are a diasporan and you enrolled, first of all, how do you get the carte santé? When you go on the website, diasporaminsante.cm, how do you get the carte santé? That's the first question I want Mono to answer. And then the second thing I would like Mono to answer is, what does the carte santé benefit you when you have it? What are the benefits? How can it serve you as a diasporan healthcare professional?
So the plan is, once you get to the website, you'll be able to put in your credentials and justify that you are actually a diasporan, and you say you're what you are. So you'll be able to register, and we're supposed to have methods where we can vet these things. And that is why during the discussion, we said we in the town hall have multiple associations that are members here. And the easiest way of vetting someone who says, I'm a cardiothoracic surgeon in Germany, is to contact the Cameroon Medical Association in Germany and ask if this guy is truly practicing as a cardiothoracic surgeon and wants to come to Cameroon, register, and do surgeries. I see my friend, Dr. Clares Pimpong is here, who is also a cardiothoracic surgeon. That's just an example of saying, once you register, there has to be a vetting process depending on the activity. So based on that, after the vetting process, which should be short and not complicated, because we would get health workers who are also where you are and they can actually testify to that. And most of the time, by using the internet and other resources, we can actually vet those, especially high-end professionals who can do risky things in Cameroon. We have seen that there are international known Cameroonians who have come to Cameroon and performed certain surgeries or certain things without anyone vetting them. But we want to have an easy method where you register for the card, gets vetted, and you have that. Now, Elvis, going to the second question, which you asked. So what was the second one again?
Like, what if you have the card, and then what? What are the benefits?
So this is where we are advocating, and I think Dr. Sammuel is also going to chime in. Once you're a diaspora, we want diasporans to have privileges also, where you're going to be able, depending on the kind of project, don't say you want to go do a little project, then you want the minister to be involved. No, it's not feasible. But if you come in with a huge project or even a little project, you should have facilitation to get to do what you want to do. Like Samuel said, get to be able to link you with the DO at that level, the SGO where in the division where you are, get to link you with, maybe you're coming with equipment to donate, link you with the regional council where you can easily do that, get prior authorization to get custom-free exportation to importation to the particular health district or the particular health center or the particular hospital that is going to benefit. If you have a huge project you're bringing into Cameroon, you should be able to have a sitting with the minister or the secretary general and those who are involved and discuss that project and get exonerations in order for you to invest in Cameroon so that partially you will benefit, but the people of Cameroon are also going to benefit. So this is all discussions that we'll have during this working group and see exactly how we can get this functional. So Samuel, anything to add, please? He's our brain. Yes. He's our brain child. So.
Thank you very much. Yes, I do have. If you are in Cameroon, I have a pharmacist who has a pharmacy in Yaoundé. He got with medication and was stopped. That's a very good example. What is the thing that I have been doing in the past, that I get in touch with the ministry and I send them a letter with everything I'm bringing into the country. So as Elvis is asking, having that card will help you to lessen some of the challenges you will face by just moving around. So if you are at the airport and you have something that you're carrying, If the custom just know that, oh, this is a registered person by you just showing your card to them, what has helped me, sometimes a letter from the minister, when I get to the airport, I present who I am, I show that letter to the minister, most of the time they let me pass. They don't even go into checking. So those are some of what the benefit you enjoy. And I just wanted to add here for others who are here to know that this is the workshop. Currently, the website is not yet functional. There's a workshop going on in order to finish everything and get the website going. So these are just samples of what you will see when the website will be up and running when you go on there to register, because there will be personal information, there will be professional information, they will look at your activities, there will be a little bit about you. So those are just a few things that they will be looking at and what you plan to do. So there is some details there that they will ask, and after you are done, then you will be able to upload some information, which even including pictures, just like what I shot there, that will help you to be able now to be validated. And so just having the card is not just automatic. That is where I think Professor Ngachu during the meeting, having the town hall and having the working group and having us, the goal will be that, just like an announcement here, if you're thinking of a project, you should start thinking of using the Cameroon Town Hall as a channel to where you can submit your information, and through the town hall, they can work with you to assist you through the process of making sure that you are registered. And once you are registered, it will make things easier for you. I will give an example. Dr. Sydney is currently in Boya right now, and it's through the town hall. It's very important to give credit to where credits are due. He will not, every moment he will text me and just say, thank you, Elvis. I mean, I would not have done this without you, Sam, Mono. And that's exactly why we're here, to make sure that we work as a team, to make your life easy. You know, we talk about customer service here, and when we go back to Cameroon, we complain that of customer service, we are not being well received. The town hall will do the best, as Elvis is saying. We might not do everything, but I mean, the minimum that we'll do will help you to be able to at least achieve, even if it is 30% of what you expected to achieve in Cameroon. I will tell you, after being there for 10 years now, that will be great, because all of us, we all have projects to go back home. At the end of the day, we get frustrated and then we abandon it. So the goal of the town hall is to help us not to be frustrated and abandon our goals and objectives that we have to realize back home.
Thank you very much, Dr. Sammuel. If I might want to make one request, can you please put on the screen the sample of the card, Sante? I just want to make a comment about it, but before, some people joined just after you had shared that draft. Can you please share it again, just so I make a comment while people see the draft? While he shares this draft, look at this draft, and I want to say what the journey is and where we hope to get to with this. I saw a comment on the chat. I hope this is not going to take another long time to issue, like the national ID card in Cameroon. First of all, this is going to be an electronic card. It must not be printed in hard copy. Unless you choose to do so, you can have it on your phone once it's issued. And the reason you see a barcode on it is because with our relationship with the Ministry of External Relations, we hope that we are going to get to a point where with this card, you don't need a visa to go to Cameroon if you have a nationality that is other than your Cameroon nationality. Take, for example, that you already have a German nationality and you have a German passport, and before going home, you need a visa. You are already having your card Sante, and you have a project you want to go do home. Well, this barcode can be scanned at the airport, and you are given the visa already. I think that this is one of the things we want to achieve with this card, that it can be able to serve even in immigration issues for you to go back home if you're no longer having your Cameroonian nationality. So this is one of the things I want the town hall to know, that we are not yet there, but that is where we hope to be as work group continues to make advocacy with the presence of the representatives from the Ministry of External Relations. So thank you very much, Dr. Sammuel, for sharing. You can stop sharing your screen. While I would want to hand over the moderation now for Brian to take over and just open it up to the audience to have a conversation now on questions. First of all, you want to ask members of the working group. If you have questions, you want to ask them. And after the question sessions, we can now want to get to some suggestions from members of the town hall, what you think could be considered as the kickoff with their work. They've had the first meeting, they're having another workshop in August. And there is a big program that is coming up in 2024. And of course, we are going to let the cat out of the basket when the right time comes.
Yeah, thanks, Elvis, and thanks a lot for your introduction and moderation as well. I just wanted to share I'm not sure if everyone has seen the text yet, and I don't know if it's possible to share this text document in the chat so everyone could have a look at specifically what the Ministry of Health has defined as the priorities. What are the needs? Because I wanted us to probably to start from there. The document is in French, so it has yeah, and
hey, Brian, sorry, I have the English version of the text signed by the minister. Do you want me to share that one?
Yes, please.
Yes, this is you can guide me and I can, yeah, this is the English version. There's one that the minister signed recently, just to make, yeah, this is the English version here.
We cannot see it, Sam.
Oh,
yeah.
Sorry, let me share my screen. Okay. Brian, can you see it?
Yes, I can see your screen. Just scroll down to the, yes, to the objective, yeah. Yes. So there are, as you can read from the document, there are several specific goals that have been defined. The first here is defining the intervention domains of the Cameroon diaspora in the health domain. The second is setting up a support mechanism for the professional insertion in the Cameroonian health system of the members of the diaspora working in the health domain, promoting and facilitating the implementation of the diaspora intervention throughout the national territory, developing mechanisms for the recognition and use of diaspora high impact initiatives in the health system, coordinating and monitoring the implementation of the diaspora activities in the health domain in Cameroon, and so on. So those are some of what the Ministry of Health defines as key priorities. But it's just like many of us who have been involved in grant writing and things of that nature, defining very specific goals and timelines of what we need to do and what priorities are is usually very crucial. So I just wanted to open it up for questions and comments. If you have any thoughts and questions and for this working group, you can just raise your hand and give your contribution, or you could also just use a chat. If you're unable to speak, you could use a chat to drop your questions or your comments, and then I would address those to the working group members. Yeah, I see Adrian has the hand up. Adrian, please go ahead.
Yeah, excellent work. Thanks for the opportunity. Again, this has been really great, and I applaud the leaders for the work that you guys are doing. So my question really pertains to what constitutes a project and a viable project, and because this is a great initiative, and I just want us to think through which kind of project the town hall will say. Is there a way for town hall to vet the project? So if I sit today and say, hey, I want to go to my village and go do something, which we are very good at, is there a mechanism to make sure there's some viability before throwing support behind it? Just to make sure at the end of the day, when we are looking at impact, we make sure that the projects that we have are going forward are going to be impactful. And also, is there a way to be able to encourage, people to form groups? So, for instance, we have our Association of Cameroonian Nurse Anesthetists, through which we make sure that we consolidate our efforts, so that each nurse anesthetist is not trying to go as an individual to go do something which is virtually impossible. So, are there any ways to encourage that kind of consolidation of efforts so that there is more impact in what we are trying to accomplish?
Yeah, thanks a lot, Adrian. That's a really pertinent question. I just want to transfer the question to Sammuel and maybe Dr. Mona as well for their remarks.
I want to thank you for your question. I think that is a very, very important question. I want to share my experience. I will always go back to look like, without us even having this platform, what have I done? I think you are right. Any person can get up and say, I have a project, and then they get a pass, they go home, and at the end of the day, they don't do anything. But this is what I have been doing before the platform, which is what we do here. When you are sent by your organization on a mission, they expect you, when you come back, to give a report of what you did. So if the platform is being built and everything put in place, of course, like I mentioned at the beginning, Town Hall has experts in all the domain of health. They will definitely work with you to find out, and whatever you are going to do in your village, whether you are just going to help build a water tank for a hospital in your village, if that was the project, we know that's what you are going to go do. At the end of that project, there will be a report. And of course, the people of that village, there will be way to know whether you actually did that. That's what we have been doing in that. Anytime we go on mission, whatever we do, the district medical officer of NDOP works with us. And it is the district medical officer that is submitting the report to the regional delegate of public health, who then again report to Yaoundé. And then, of course, Yaoundé, in response, we appreciate what we have done. So I'm saying this, which your question is very important, and that's why we're here, just to represent. And your ideas of even having a group that will actually be very excellent, and putting resources together is always something welcome. Dr. Mono, I think that's what I think, and I believe that as we work together through the working group is an advisory body, and those recommendations, we will definitely work together to see that if you have such a project, that project will be vetted. And I mean, when the Ministry of External Relations and the Ministry of Health said they will follow you, most of the time they will actually send somebody to accompany you, like to help you navigate the terrain as you go. So those are some of the advantages that you will have while you are there. You will actually have somebody there who if you need anything, if you need help to get authorization to even do that project, you don't just go to Cameroon and do something. The rules are there, and then there will be somebody on the ground that will actually help you.
Yeah. Yes, Samuel, I think you responded very well to those questions. I just want to applaud Dr. Edwin Aruke for the wonderful things their organization does in Cameroon and the impact they have had even in training and education in the University of Boya, and want to encourage them to continue what they're doing. And I really buy to the idea that, especially when we are back in the diaspora, if we have associations, putting our strengths together, it's usually always a good thing. So that proposal that he's giving, I think all of us sitting here, we should be able to act as groups. And if you want to act as an individual, we would discuss with the town hall and with the diasporans to see exactly, we have experts that can vet a lot of things. If you want to use this platform, then you need to be able to give a post report or a post report of whatever you did, so that we can monitor and evaluate and be able to see the impact that you created, so that you yourself will know exactly if the project that you did, can you modify it next time? And is it something that others can replicate in other regions in the country? So yeah, thank you.
Yeah, thanks, Dr. Mono. I want to, before I pass it on to Crespo and Franklin, the document doesn't also, one of the things, the specificity in terms of what constitutes a project and what is a priority project considered in this text by the Ministry of Health. I think that's one of the things I heard from Dr. Aroke's question, which I think it's not very clear in the document itself. What would constitute a priority project at the Ministry of Health?
Yeah, during our discussion, I think both Sammuel and I think Prof is here also with Larissa, they can always chime in. I think during our discussion, that was going to be one of the questions which I channeled later on, for the ministry to be able to define areas of priority. So to them, what are the areas of priority, the areas of need they feel that the diaspora will be helpful? Are there specific public health problems? Are there specific healthcare problems? Are there specific training problems that they have that they feel that the diaspora can easily help out? And if those priorities are labeled, then we'll be able to know. I think during our working sessions, that's something we're going to help define. And this has to come from the Cameroonian ministry itself and the people of Cameroon, what they think are their needs. Because if you don't prioritize your needs, everyone can come in with a project and decide not knowing where to go. We do know in Cameroon, we have very few functional cardiothoracic surgeons. We had a cardiac center, I'm just giving examples, that was working in Shisham, but with the crisis, it's no longer very operational. We do know that we have multiple other things going on in Cameroon, issues with radiation oncology, the number of centers, the number of machines that are even working, functional in the first place in terms of that. We do know, is it a priority? Is cancer even a priority for the Cameroonian government? Should we even be getting them to invest in that? Do they think it's a public health problem? Do we have documents and research to show that this is a public health problem in the first place? Is breast cancer a public health problem? Is cervical cancer a public health problem? Should we be able to galvanize oncologists who are trained in the diaspora to come back home and help in the training? Do they need, they are training 10 oncologists in Cameroon every year. Do they need help with the training of these oncologists? Do they need partnerships? I'm just giving in my field. So Cameroon needs to actually really define that, as you said, Brian, and be able to tell us the areas of priority, why we in the diaspora also define our own areas of priority that we think we can invest in. Because there is also philanthropy, there is investment, and there are multiple other things that are going to take place here.
Thanks for your remarks, Dr. Mono, and I want to pass it on to Chris.
Yeah, thank you very much, Brian, and thanks everyone. I think that was the very first question I was going to ask in terms of defining this purchase, like what exactly it is. And I also wanted to ask in terms of the criteria. So who is screening? Would it be us or MinSante? And I think Mono has tried to talk a little bit about that one. Other questions that I had is, how are we going to make this project an equilibrium in terms of the way we would run them in Cameroon? For the most part, the most people who've been part of this group, they're usually, I would say, the Great South of Cameroon. How is there any definition in this action plan in terms of redistribution of the projects around the country, or is it just going to be everyone trying to do something in their local village so that they can have the accolades of their chief to say, yeah, this person has been doing something in our village? So how are we going to make sure that every Cameroonian citizen is benefiting from what we're trying to do? I have been volunteering with the Pacha Foundation for 10 years now, and they carry out medical missions in Cameroon. one major thing that we've faced over the years is that there's been a problem with follow-up. They deal with cancer. Cancer is not a thing that you go for a month and then you're done with it. So now, is there, I mean, we are here and we will be doing things back there. For sure, budget is really a thing. Is there a way that if we have our own budget or we have some money that we're coming to do stuff, is there a way that the MinSante is going to kind of cover for some of these follow-ups when we do projects and we go? Is there any budget? Have you guys discussed a little bit with them in terms of follow-up, or we will still be here and contribute to follow-up to complete those projects? And in terms of domain as well, I think Mono talked about that. I was going to say, what are we really focusing on? Is it really just open net, whatever we catch, we are catching, or are we narrowing down? Because I think if we ask all these questions from the beginning, then we will really know what to do. And it's really good to start asking them and build from the beginning so that in the future, when all these other things start coming, we'll know how to. So those are some of the questions that I had.
Okay, so let me react to some of them, Crespo. I am a believer that you partner with the government because you want sustainability.
Yeah.
Not every philanthropic activity given to Africa is beneficial. Some of them are there to create more problems. I'll tell you this story, and I always say it. In the extreme north in Cameroon, many years ago, UNICEF came in and created wells around the households of those who were living in the Mora region. They created wells there for them because they thought they lacked water. And they came back after 5 years to evaluate those projects. All those wells were destroyed by the women in those localities. They destroyed the wells. This is what happens when you do projects without involving the people. They were all living in very well-controlled Islamic conditions where the women could not go out. The only way they went out to see their boyfriends and have extramarital activities and other things, even the young girls, was when they went to carry water. So creating and giving them water created more health problems for them that they did not want, or more social problems. So that is why involving the community in whatever project you want to do is super important. Involving the government is important. When I moved to the US, this was not when I migrated here. In 2010, I came to a project called Women Deliver. It was a scholarship, myself with Dr. Efwe Valerie, not here. We advocated strongly for the HIV program to be taken away from the CDC and given to the Cameroonian government, despite the amount of corruption. Why? Because that project was not benefiting all of Cameroon. No matter the amount of corruption that was going on, the rest of Cameroon, mother and child health was not being benefited. And I spoke strongly in front of the American Senate about this that day. It had nothing to do with the cities. I had no problems with that, but I had something to do with a project that it's going to, if your goal is to affect and benefit everyone in the interior, there's a network already in place. I'm not against anything. I'm just giving you this as a discussion. So defining our goals can be defined in two ways. What the ministry wants, they need to define their goals. You as an individual needs to define your goals. I cannot force you, Crespo, to co-invest in Extreme North. And the ministry cannot force you to go invest in Extreme North if you're a diaspora. And if you want to do that in DOP, and keep doing it in DOP, but don't replicate the same thing that, I'm just giving an example. I'm not saying that's where you're from. Yeah. Don't do the same thing that Dr. Sammuel is already doing. And let's not have 100 projects doing the same thing. If we want to invest there, we can do different things because that's not your obligation. You're just supplementing what the state's activities is supposed to be. But we should, if we want the ministry to be part of our project, when I was young, they used to be, I will call it, it's an open professor, Dr. Wari, who used to come to Batigo and do surgery. And later on, Dr. Angwafo, who is not here, would remain later on with the whole population coming back to him for those hydrographies that they have come for 1 or 2 days. You see, it creates a public health problem and keeps a problem for those who are back home to deal with.
Yeah.
If he does not have equipment to do free surgeries, they'll say he's a bad district medical officer or director of the district hospital in Batibo.
Yeah.
That is how I learned a lot of my surgeries. So we had to stay back multiple weeks undergoing surgeries to those patients that they came and promised surgeries to them. And he had to integrate that, his activity with the district hospital, and later on provided them with equipment and also with materials to continue the surgery when he leaves. There is issue of every Cameroonian benefiting. The truth about it is that I'm going to give this on my personal ideas also. The diaspora, you cannot read, you can actually, by creating a website, give opportunity for people to invest in multiple projects. Some of them may be philanthropic investments, others will be financial investments, others will be creating jobs for other young people back home. We're having a crisis now. We have so many medical schools, many doctors without many equipments and hospitals, though we have people who are sick where we can employ them.
That's true.
Our government has created a problem for itself by looking at healthcare as just creating doctors. That's not all of healthcare. Cameroon does not have even specialized nurses in different departments. Cameroon does not have even specialized other people who are involved in healthcare. There is nothing like training of physical therapists. There are some few schools. There is nothing like training of medical technician, different laboratory subspecialties. There's no investment in that. There is no investment in someone who's going to accompany a cardiothoracic. If I go back home and I'm an oncologist, I want to work, I don't have oncology nurses that have been trained in Cameroon. Do I? No.
No.
I don't have people who can accompany me in this work process that I'm going to do. It's not just by training me. It's not like these are the advice that we want to be sitting. The worst thing you can ever do is not sit at the table where decisions are made. Even if you want to riot and leave, and you don't sit at the table where decisions are made, decisions will be made against you. And I tell this to the doctors all the time when they are complaining. No matter how much the person pushes you, stay on the table, stay where the decisions are made so that you can make your voice heard. There is no day, there are problems everywhere, even in the US. I've worked in very high-end level systems, even in Colombia and in Presbyterian. If you are not sitting there to make decisions, accountants will make all the decisions for you. Guys who are young, 22 years old, who are investors will make the decisions, and you guys are going to do the work. So the problem in this whole thing is, as diasporans, we have created a forum where you had a lot of questions, where we can sit in the room where those decisions are made. We can ask questions. We have access to those people who make those decisions, and we can advocate for the diaspora and for the people we love. All of us here in the diaspora, and we have family members home. I have my mother home who is sick and has to be taken care of by doctors back home. You need respect. Yeah. You also need to make sure that they understand we're learning from them and they're learning from us. It's a two-way traffic. It's not a one-way traffic. All health professionals, it's a two-way traffic. So don't go home with your extravagant projects that you feel they are not sustainable and feel that the government should take over them. That's why in the beginning, if you involve the government in any kind of project, if you go home and screen for cancers, breast cancers, and then you have breast cancers that develop and you don't have a method of managing them, and you know quite well that Cameroon does not have any, Cameroon has very few oncology centers that can even do things. We are unable to do estrogen and progesterone levels except in Central Pasteur. That is the peak of poor investment. You cannot invest, I'll say this aloud, you cannot invest in creating big imaging centers when you're unable to do a simple immunochemistry study. 80% of women in Cameroon get chemotherapy for breast cancer when they don't need it. Research has to prove that they don't need it. Many people, it's not because I can operate and take away your breast that I should take it away. 80% of those who are treated for cancers in Cameroon with mastectomies and surgeries do not even need it because they were already advanced. There is statistics showing that 80%, if you do tests for them, you would see that. So those in the diaspora, we should be careful. I've always said that when we go home, sit on the table, make decisions. I don't have anything against you wanting to invest back where you're coming from, but you should also understand that you should not go and replicate projects that are going on. Collaborate, and the ministry will be able to help us. Be humble. As Sammuel said, we should go with solutions, not just cry out problems. We should be the bearers of what we think we can give back home to our people. Instead of complaining, we should make suggestions. Instead of looking at corporates, we should actually find solutions to some of these problems. That's why, to me, it's always about solution. Instead of playing victim game, we should try to see how we can become winners with the government. So that's just my proposal.
Well, thanks a lot for those remarks. And you said something that really struck me about the screening for breast cancer, but not having diagnostic capacity for quantification of estrogen and progesterone. And it sort of reminded me of the advances we've seen in the last few years in just in the field of genomics, for example. Sequencing 10 years ago used to be done with very giant machines like Sanger sequencing technologies. But in the last few years, the advances we've seen in sequencing has expanded to the point where you can have a sequencer that's the size of your cell phone. So you can almost do the whole genome sequence on a pathogen just with a device as small as your cell phone and actually obtain a complete genome. So I think if you're aware of groups in the United States that are significantly more advanced, where we can leverage some of those technologies back home, I think that'll be helpful. I think doing a lot of things in Centre Pasteur is great, and I think Centre Pasteur has immensely helped us immensely. But I think if we could have some of those laboratory, the ability, the capacity to have those sort of diagnostics, point of diagnostic techniques in our local hospitals and make those even more widely available, I think those would be very helpful, Dr. Mono. Before I go to Maloba, I just want to ask if Martel, he asked a question in the chat, or I think it was a comment, and I just wanted to call on him to expand on that. He said on community project, he suggests to use the logic model to incept the community project. So Martel, I don't know if you're still on the call. Could you expand a little bit more on what this logic model means and more comments on that? If you're speaking, we cannot hear you. Okay, I think we'll get back to Martel later. So Maloba, sorry, please take it away.
Yeah, good morning, everyone. Yeah, once again, I wish to thank the Town Hall for always bringing interesting topics. Yeah, I think this was a very interesting topic, and I really enjoyed it. And it's something pertinent to our community, especially Cameroon and Africa at large. I have two questions. My first question is, before the Town Hall platform, other platform has already been existing and individual project has been going in this same direction. What can we say is the feedback of these different platforms and the project? What are their downfall? What are their strengths? And what has this project, this new platform, taken from that in order to make sure that there's better improvement, not to repeat what others have already done? That's not to add to what people have been doing. My second question is, we always mention like diaspora just needs to go back to Cameroon to support, give new ideas. But the point is, what are we thinking like the Town Hall or the platform can encourage Cameroonians to go back to Cameroon and even work, be with the people one-on-one and give their services there? Why do we always think we just need to go there, give their support and come back? First of all, I don't know what the ministry too is doing to attract the diasporans who have been here to come back home and put their services on the ground without thinking like, oh, I must go abroad. As they mentioned, brain draining. What are they doing to reduce this brain draining? Those are the questions we should be asking sometimes, you know. What is failing? How can we make it work? We should not just be coming thinking that we can bring this fascinating idea. They are always good when talking on the paper, but when you go to the ground, it's quite different. What can we do to make it tangible? Thank you.
I don't know if someone wants to go or I should go first.
So I wanted to give Elvis the chance, and then I will add, I think there are some points that he wants to talk. I haven't talked to him, but it will be helpful for us.
No, thanks so much. I wanted to, before get to Maloba's question, also talk about the question that was asked about the kind of project that we should, what kind of project constitute a major project to be done back home. I'm a believer of, no matter how big your dream is, please keep it simple. That's the only way you can get things done. And I don't want anybody in the town hall to feel inferior in any way that my project might not be enough to make me a part of this whole initiative, or my project might be too little for me to get a carte sanitaire to go to Cameroon. No, I believe that no matter how small your project is, if it's going to change the health of one person in Cameroon and make that health of that person better, that project is important. I don't want anybody to live with a complex that we are coming here for some big gigantic ideas. Let's keep it as simple as it is. Everybody in the town hall comes from a village in Cameroon. If you can even just think at village level, what that means to you, improving the health center in your village. I come from Misaje, if I come from Balinyonga, if I want to improve on the health center in Ndinjiakat, that's important. Whatever I will do to improve on that health center is important. If you're going to do any program that you think can improve the life of Cameroonians, it's as important as we mean when we talk about programs. But on the other hand, we said government might have other objective or areas of interest. That means that that is the area the government can tell the town hall that, please look in your group and see those who are experts in this domain and tell them that, please, we really need them to help us. So the town hall will use government's priority to advertise and let us know that government needs these things back home. And of course, government is not going to force anybody to say, come do it. It's just going to be an expression of need so that people can actually see, oh, there is a need to train nurse anesthetists. So the Cameroonian Association of Nurse Anesthetists in America will constitute that group and go give that training because they think government has expressed need. So let's dream big, but let's try to keep it simple so we don't scare anyone from being part of this great initiative. And back to Maloba, your question is very interesting. The first thing I would say is if I were to ask Maloba, please pack and go back to Cameroon, I don't know if you will accept to go, but if you will accept, then it can be very easy for everyone to go back home. I think government is not going to force anyone anywhere, anytime to go back to Cameroon because your decision to go out was not done in collaboration with government initiative. Everybody left the country for their own personal reasons, for their own personal gains. Anywhere anybody is at this moment as a diasporan is based on their individual decision and interest. And so the only thing that the town hall is saying is don't forget about home, right? The diaspora is not saying go back and stay in Cameroon and do anything. But if anybody thinks that going back home and staying in Cameroon can be facilitated by the Ministry of Health, then Maloba is right. How can the Ministry of Health make you feel like going to stay back home? And the Ministry of Health can do it just the way they are doing to some of those who are going to invest back home. I see someone like Sydney is already like a boy now, but he works in the United States. He's a very big radiologist here in the United States. But all this time, each time I talk with Sydney, he says I'm in Boya eating fish, and I feel jealous. Like he just came back from Boya. Why? Because he has a multi-million investment in Boya, clear radiology, not advertising it, but he's putting more than 500 million in this investment in Boya. So that makes him to be home all the time. So if his investment can make him stay home, then that's what Maloba is saying. What can government?
My question, Dr. Dasti, yeah, maybe you didn't get my question is, you know, the town hall is doing good job. It's not like I'm totally for the town hall initiative. Yeah, but the truth is there are some, I've seen Cameroonians here who have learned, they have their degree, but they want to go home, but they cannot go home because they are trying to seek things like asylum to be here because they just think that going back home, they cannot be able with a salary and the amount that the government give, the package, they will not be able to sustain themselves and their family with their dependents. So it's not like something personal, but it's just because you see them here, they don't even have work, they are really struggling, you know, but these are people that can be very useful back home. So what can the government do to attract such people to say, oh, even in home, I can make it, rather than thinking that everything, the truth is, all of us cannot just be getting these millions to go back home, big projects to stay there. Not all of us are blessed to be that way. Yeah, some of us can just go back home with a little we can contribute in helping this population through our work. but what is the attraction, you know? Because when they were mentioning about increasing salary, I would say, oh, maybe this increase in salary will go, but 5%, just 10,000 increase, you know? So I was asking like, what, these are the things. So the government should make an attraction for us in the diaspora who have the zeal to go back home to say, yes, at least I can have that security, I can have that money to take care of myself and the extended family that we have, very big families, you know? Yeah.
Thank you. Thank you,
Thank
Maloba.
you very much. Elvis, if you want.
I'll hand it over to you, Samuel, to answer if you have some other contributions, but I think the Ministry of Fonction Publique is in charge of salaries and all the career management of Cameroonians, and hopefully maybe there would be somebody from that ministry to attend to this, but I think the Ministry of Health has a limit of what they can do when it comes to managing personnel, and but it's a very great suggestion, which I think can help some people go back home. But let's try to see what the town hall can do and do the best we can do to just do what we can do. But the problems, as I said from the very beginning of the town hall, is that there are so many problems. And if the town hall stretches out to solve so many problems, we might, at the end of the day, disperse our energy a lot. But good ideas like that, we can channel them to the right quarters where they will get the right attention. But it's really a great idea Maloba brought.
Yeah, thanks.
Yes, Sammuel has something to say, yeah?
Yes, so what I just wanted to add, I know maybe others are joining again. I think Elvis said it all, but I've heard the question from Maloba and also the others. The town hall, because we are talking about what is the definition, what is the project. They are in two folds here, as Elvis and Mono has also explained. The first thing I would say to add to that is that when the minister came to the town hall, we asked him questions. One of the things that he even said openly, because we talk about going home, getting visas, and he even mentioned that we know that you are all Cameroonians. Even whatever you want to do in Cameroon, I am here. So far as I'm the minister now, I can help facilitate what you are doing. Now also, he promised to help us in a group through the town hall, which, as Elvis has said, but not canceling the fact that this is not the Cameroon government trying to come to tell us what to do, but it's also him trying to help us. Elvis has already mentioned this. I just wanted to I think that part maybe is still not clear, even though we have some objective to achieve through the working group. But if you as an individual, you want to do something, don't feel that the government will control you, but they will assist you. So the minister, back to Maloba's point, is putting this is the first way of how can we assist. The reality back in Cameroon is that the government is the sole employer. But if you have what Sydney is doing, we have to be realistic. We have to be practical. I'm with Elvis. So these big jobs that we're going to have in Cameroon with big salary will never come so far as our government will remain the sole employer. But if we now, starting from the first phase, just at the basic now, having a working relationship with the government, we can then find a way to contribute ideas that can lay the groundwork for those who want to go back and contribute. You might not have the capital to do the work in Cameroon or to invest, but you have the knowledge, and you can start by helping somebody like me or helping Sydney's in all your profession or helping others. Contributing back home in your own little way is what we're looking now, because there are major, huge problems we can look to solve. But I don't think Elvis already put it at the beginning. We might not solve all of it now, but at least having that foundation that one day can lead us to that. That is why I actually have that my slide, which the chair brought it up again. So let's have a firm foundation where all our solution, even if at the end we might not resolve it now, but it will build and lay the groundwork with us and our government back home.
Yeah, thanks a lot, Dr. Sammuel, for your remarks. And Elvis, did you have some question to ask, or that was it?
I think that was it. You can go on with the other people who have their hands up.
Sure, thanks. Kathy, please take it away.
I think I had a second question that was not answered. The second question was, there are already existing platforms in Cameroon, and this is a new platform that is coming, and other individuals are taking initiative in this line to Cameroon. It's not like the town hall must do this. No, I'm asking, are there any other people or entity or the government that have assessed this existing platform and also these individuals, what they have done to see where they failed, where they succeed, and to put this data so that those who are coming with new platform can learn from this to know how to better improve on the system? Is there anything like that?
Yes, and the chair, maybe you can add. Let me just show. Let me show this again. I just want to show it that one of the recommendations at our first session is for us in diaspora to try to identify other platforms that are already existing and see how we can bring them together. They might not want to join us, but it will be a suggestion. Now that the town hall is already having this working relationship with the ministry, if you look at point number 3, trying to look at other groups that are already doing something back home. How can we all come together to put our resources together? So it's just a recommendation that a working group will be looking into it, and having you, Dr. Maluba, and others who want to suggest idea of how we can do this. That is what we're looking forward to and what the town hall will be working. So you just mentioned what was already considered as one of the recommendations. I don't know if I've answered your question.
Yeah, so just to add is that I don't personally know of any group that was actually coordinated by the Ministry for the Diaspora before. This is the first time. So there have been other groups, but I want to make that very clear. This is the first time, but there have been other groups that have been created, diasporan groups. There are multiple projects. There are groups like the health professionals in France, those in England, who did a huge investment in Cameroon during COVID. There is the American and Canada medical professionals. There is the group of anesthesia nurses. As I told you, they did marvelous job in Boya. They're doing a lot of training. We know so many of these groups. Aroke is their president and he's here. Many of these groups have gone to Cameroon. There are foundations like the Partial Foundation. There are multiple other foundations. There is one other foundation, which, how's it called? Multiple. I can't even list all of them. But we have a problem in Cameroon, is always monitoring and evaluation. Because this is something that at the end of the day, if we can monitor and evaluate and have our data published, some of these organizations are doing it. Some of them are doing it. Like the Ndinjiakat Foundation, I see them, I follow them all the time, but they are involved a lot in policy. A lot of these organizations are doing it, but we cannot tell you in the town hall that we have evaluated that data. We're able to tell you what they have done, where they failed, but that is why we are here. And that was mentioned during our meeting. Let's figure out what happened. And if we can encourage young Cameroonians, even those in the diaspora, to do kind of research. This is meta-analysis. We can actually get data and research on what happened, policy research. And one thing I want to really say is that feedback is very important. Maloba, feedback is important in anything you do. We need feedback. Absolutely. And the feedback is in order for us to know the way forward. The ministry is going to need feedback going forward. What we are going to do now, we cannot solve problems in Cameroon, but Cameroon has rich people, even in Cameroon, who can invest and create jobs. Cameroon has rich people in the diaspora who could invest and create jobs. And the town hall is not going to create a favorable environment in order for us to be able to create businesses in Cameroon. But we can advocate for that. Okay. So and that is what we are going to do, because in order for us, the government alone cannot be, in no country that exists on earth, the government is going to crumble. The government alone cannot be the sole employer of all its citizens. Once the government takes that as its action, it's not going to fail. It's going to fail. Just by increasing salary, we need to create an environment where we can easily create investment. So those who are professors in the diaspora who want to go home, they can be able to have their ideas and create maybe research teams and other things going on home. That's the way I look at it. But I think this platform, we can advocate for that. Thanks.
Yeah, thanks. I just want to echo the comment from Tim Fabrice in the chat that just in response to what you said, Franklin, that this is an opportunity for different diaspora groups to join their efforts to create more impact. And I completely resonate with that. Over to you, Kate.
Yeah, thank you. Thank you very much. And also for all the comments that have been made. Excuse my voice. Sorry. I think I've got a question just to find out on some of the things that were discussed during the meeting as well. But before I get to that question, I just want to hit on the point of, we've talked about brain drain. We've talked about the term Elvis used was brain train. Brain train. And I want to add another, I want to add another term to that, which is brain circulation. And that is actually, I believe Sydney falls in that particular category with what Elvis was talking about, where you know, you are basically in 2 continents, you know, in the space of less than a week, actually doing things. And I believe, you know, as we go forward, I think we have a social responsibility as Cameroonians, no matter where we are found, whether in Cameroon, in the US or abroad, to be able to create a favorable environment where there can be adequate brain circulation. We live in a very fast-paced world, and we do not really have to sit back with our archaic ways of doing things and thinking that we can only have one system and one way of doing things to be able to achieve the kind of development we need to achieve as a nation and as a country. So brain drain, brain teach, brain circulation. So, and my question is, I saw on the list that we have the National Medical Council, and I don't know if discussions were made or done around the registration of doctors who work abroad, like most of you here, with the Cameroonian National Medical Council, and also how that can be facilitated, and discussions around how other medical sectors can be involved in this work. Because the health system, we have that thought that our health system is very doctor-oriented. And for any health system to function, we need to get out of that doctor orientation and really make it holistic, that kind of holistic human resource approach. So like the Nursing Council, the Medical Lab Technologies and Sciences Council, now we've got pharmacy, we've got maybe dentistry. I think there's a newly created core, which is that, or I think medical nutrition. I don't know if there were some discussions around that.
On research as well.
Of course, not forgetting.
Hey, Dr. Mono, I think this being the very first meeting, I keep going back to that table of recommendations. Now that we are here and we are receiving this information, I would say it is something very important. And if you look at that, those who are part of that working group in the ministry, I think every subsections of the ministry, they are represented. And of course, you have the Cameroon Medical Council. In one of my meetings with the Cameroon Pharmacy Association in the US, one of the suggestions that I gave to them was for them to work with the Cameroon Pharmacy Association in Cameroon in order to be registered and be eligible. If they were to go back home, they can practice. So to your point, Dr. Kate, that is an important point that we can note as we continue in subsequent sessions. We can start that discussion. Now we are also learning to know each other as members. And as we continue, that will give us the opportunity to first of all, know who is representing the Cameroon Medical Council, working with them, and these kind of discussions. I think Elvis has already received some recommendations about nurses, which we were trying to know whether as nurses in Cameroon, and all nurses, do they even belong to the nursing association? So those are things that we can be talking as we move forward, looking how to get involved with them, and then these recommendations like having doctors from diaspora to be registered with the Cameroon Medical Council. And to add to your point, Dr. Kate, in DOP, the hospital that we have in DOP, the ministry helped me and told me that if you want to have doctors, right now the Cameroon government is no more employing doctors when they graduate. So if they are no more employing them, they will go in private practice. There is now a document for doctors to practice as a private practitioner in Cameroon. Those are the things that we need to be looking up to, like how are we working with this new setup? So to your question, I would say it was not in discussion because this first session was more about knowing ourselves, getting to know each other, looking at setting up a working plan for the platform and moving from there. So I want to say thank you for that. That's something that we can take note of as we move on.
Yeah, thanks a lot, Sam. I see Professor Ngachu's hand is up, so I was wondering if he wanted to make an additional comment or had a question. Professor Ngachu.
Yes, thanks, Brian. I wanted to add something to what Dr. Sammuel has said in response to Dr. Kate. The Cameroon Medical Council does not officially register diasporans. But at the meeting, when we made, that point was actually brought up, and the Secretary General, who is a member of the council, actually pointed out that if a diasporan, somebody who is not Cameroonian, wants to work in Cameroon, they can get a temporary registration. And in fact, registering on the platform should actually facilitate having that temporary registration. So saying that there is a possibility of having a temporary registration to carry out specific activities. And I think the key thing here, and which I think the ministry and the government is driving, is for people to register on the platform. And registering on the platform actually makes you known, gets you vetted, and makes it easier for you to get certain things such as your temporary registration. I don't know if that answers your question, Jean-Claude.
Yes, of course, Prof. I actually asked that question. I thought you had got off because I know, for example, from some of our CamDoc meetings, I've heard you say some of these. But I think this platform really brings, from your response, really brings a new wave and a new light to this process, which I think would go a long way to encourage, Cameroonians abroad to register, to do work back home. Thank you.
Yeah, thanks. Thank you. Thanks a lot, Prof. I want to pass it on to Sydney. Sydney Taza, please take it away.
Hi, everyone. The pleasure to be back here at the town hall. Yeah, like Amuna was saying, or Sam was saying, yes, I spent a lot of time between Cameroon and the USA. In fact, I just came back to the US last night to continue with the things that we're doing in Cameroon. I just wanted to make a few comments. Very good discussions. The working group that is the topic of discussion today. One thing I'd like to remind the members of the town hall is that working group is a subset, right? It's a product of this town hall. Now, obviously, the working group is there to help facilitate how the government helps some of us who are going back home to invest and help our country. But let's not forget that the government is there to help, but the town hall also, one very good thing the town hall does is put these young adults, young medical professionals who want to invest in Cameroon, put them in contact with other like-minded individuals. So, for example, I am not a government, right? The government is going to help us to facilitate us to get set up. but I'm in a position where I can now be a helping hand, where I can walk people through. I can tell them, here's what you need to do. Just about a year ago, I was also new to the town hall, but just in the last 6, 8, 10 months, I'm in a position where I'm going to throw my hat out there and say, for those who are trying to do things in Cameroon, yes, I'm here as part of the town hall to help you guys too, because the government can only do so much. Because like Dr. Muno rightly said, the government cannot employ everybody, right? That's not the methodology that is sustainable. The American economy was built on the private sector. So when you collaborate with people in this group, they say if you want to win a game, yeah, you can be a smart person, very intelligent, you can win a match. If you want to win a championship, you work with other people. So let's always keep our focus on remember that there's a lot of help just within the town hall. We are trying to create a revolving door, right, where the experts in Cameroon and in USA we are going in and out. That way we can continuously improve and innovate. The Cameroon government would help you so much, but it comes down to you, that project that you're working on, and you being determined. And I am here to hold your hand, to work with you. Muno and Elvis and they always have their hands full with a lot of things. Don't feel like you only have to call them. You can always call me personally. I'll work with you day in, day out to help you out in any of the projects that you're doing. And I think that I've never seen so much being accomplished in such a short time by this town hall. And I really want to give kudos to everybody on here who has been persistently pushing. Dr. Sam Ndinjiakat especially. Again, I'm here for you guys too. We're still working through our project, but I'll tell you it's a big success story, and it can be done. It can be done, and don't feel shy. No project is too small. Don't feel shy. But I'm here for you guys. So that's just my first comment that I was gonna make. And then the second comment is that Dr. Sam talked about that when you going back to Cameroon to invest, that about that humility. And we as human beings, it's normal for us to be skeptical about anything, right? When something is presented to us the first time, we're skeptical, when we start asking too many questions. But that humility, right? When we are there, the minister knows why he's really putting all this effort, because he knows that what we can do for Cameroon is huge, right? Not everybody on the ground thinks the same. So having that humility that we're coming to Cameroon as partners to work with them and not to displace them. And we are very intelligent people in the US, and we are going back because we think that we can help out. But let's not go out there and let's not go to Cameroon and make people feel threatened, because by human nature there's going to be that kick. They're going to want to kick back and push back, and that is not what this town hall is trying to promote. We want to bring people together and not to put people apart. So those are my 2 comments. Feel free, like I said, reach out to me anytime, and I'm here for you guys.
Yeah, thanks, Dazi. Thanks a lot. Someone made a comment in the chat. Thanks a lot for accepting to be a facilitator. It's really great to hear all the great work you're doing in Cameroon. I wanted to circle back before I pass it on to you, Francois. Please, just one question in the chat from Dr. Aroke. Aroke said, Dr. Sammuel, I'd like you to address this. What are some of the specific short-term and long-term goals? I don't know if those have been. What do you picture in mind? What would success look like 5 years, 10 years from now, in terms of this? So I just wanted, if you could expand a little bit more on what I think Dr. Edwin has been sending this question in different ways, saying this in different ways, but some of the specificities in terms of what the long-term, intermediate, and short-term goals for this would be.
Thank you very much, Brian. This is how I look at it. I will try to answer it in this way. I want to go back to, again, appreciating the minister and appreciating the town hall. The first thing is that many of us in diaspora, I live in Dallas, I know of many doctors and healthcare professionals who want to go back home to do something. That's the first thing. We want to contribute back. And then we always have the challenge is that I think the common notion is our government will not let us. So now we have a minister of public health who is saying, I am here Okay, I am not only just going to say I'm available, because if we remember when he was on the town hall, the comment was that, well, the minister, what he is saying, there are many of us, we come to the ministry and you will spend 4 or 5 days and you will not even have anybody that will hear you or even listen to you. And what has he done? He has worked with the town hall to create a working group that will now facilitate so that your voice can be heard. That's where I want to first start. So now I have a doctor from Ghana who had a plan to do what we are doing in Cameroon. And what was his short-term goal? His plan, first of all, was to join us and help during our mission trip. So we started by just doing mission trips in Cameroon before we even think of building start building a hospital. Maybe you have a plan to do something back home, because the focus of the town hall is to get us to contribute back home. If you have a plan to do something back home, maybe joining Sydney or joining others, joining the Pacha Foundation, just first of all to know, because what Sydney just said, sometimes we want to just go back to do something, and then we don't even know exactly how it functions, but we go back home and tell them, this is how, if you do it this way, then it will work. But without first of all knowing exactly what they are doing, because first of all, you want to first of all know what is wrong before you try to bring solution to the problem. So the short-term goal will be, like the minister actually said, if you are a professor and you want to give a lecture to the University of Boya, he will help you to give that lecture before you not think of unemployment in Cameroon, if employment in Cameroon is the long-term goal. You might want to be a professor back in Cameroon, and without even going as a visiting professor, you might not love it there and you want to go back. So the short term will be that, get involved, see if it is truly what you want to do. And then once you start understanding the conditions on the ground, you can then think of your main project to do. I don't know if I've answered the question. When we started, I will talk about us. The first thing was to reach out to the government. And then they said, hey, join other medical mission team coming to Cameroon. We went to Cameroon, then we started our own foundation. We went and did mission. Then from there, the government started telling us on how we can actually set up a clinic, and we followed that step. And so now we're working on big things. We're looking at being even the leaders in building healthiest community. So you have to start from somewhere, getting involved, maybe just in this town hall. The town hall needs many people to help. I want to appreciate Brian always being here every day, just to moderate. I mean, that is so huge. He has a lot of knowledge that we're learning from him, and many other members of the town hall, Dr. Kate, Christelle, and others. I would say the short term should be start participating. From there, you will learn and you will actually understand how to do something. I've learned a lot since I started coming to the town hall.
Merci. No, any comments or?
No comments to add for this one. Yeah, I'm on call, so they're texting me from the hospital, so I'm sorry. Yeah.
Understand. Yeah. Francois, please take it away. Francois.
Maybe she's talking, Francois, we're not getting you.
Hello, can you hear me?
Yes, but it's a little bit,
Okay.
your voice is a little muted. Yes, if you can raise your voice a little bit, that'll be helpful.
Okay, it's raining here, and so the weather is not very good. Good evening, everyone, and thank you again for this exciting conversation. I've really to every bit of conversation, and the little I want to bring is diasporas for the work that is being I want to say that sometimes the support may not really be only financial, may also be a kind of volunteer support. We see that some people are doing a lot of work in different things, and also good to get close to see what they are doing. So Foma, you promised in our organization in February, we were very happy. We wanted people like that to come and see we are know know the kind of suggestion, the kind of contribution we can bring to help do better in an organization in a rural community. And so what I want to say is that as we look at coming back home to help us, we should really, really look at sharing also and technical support that we given to some to emerge in what they are doing and also help to analyze what they are doing. So that is the bit I wanted to add. Thank you.
Merci beaucoup, François. On a un peu eu des difficultés à vous entendre parce que je pense qu'il y avait un peu, le son était un peu très faible. Mais j'ai l'impression, I have the impression that if I try to do a summary is to some of that we should also not only grossly about the big projects, but also the technicalities in terms of feasibility of some of those individual projects. I think that sort of reminds me of what one of the comments Mattel made in the chat around the logic model, which I was just learning about for the first time, which sort of defines very specific goals and inputs and what things needs to go into the model and what sorts of activities and tasks are needed, what are the outputs, what are the short-term outcomes and things like that. So in terms of measuring what the feasibility of those projects is really crucial, François, and I really appreciate it if you could also type in the chat, that would be helpful.
So, yeah, I would just put a little bit, I've been working with François, collaborating or talking as it's very important because François made a very important statement. If she may permit, I would just share a little bit of light into what she's talking about. The diaspora is always very important because we do have a sickle cell project in Cameroon trying to do sickle cell transplantation, bone marrow transplantation for multiple Cameroonian sickle cell patients. And when we François got to me and we got to evaluate, I got to evaluate the project and the sustainability of it. I think that will be a huge mistake when you have things conceived by whites in Germany coming to Cameroon and think they could transplant these patients, who is going to take care of them, post-transplant care and all of that. The amount of money invested in those kind of projects, if they were vetted by experts in Cameroon and those also in the diaspora, we would have invested that money in a different way of taking care of those patients that would impact thousands of patients. And understanding how difficult it is to even get a match for Black patients and how difficult it is to actually take care of those patients. So Françoise was going in that light also because of what she's doing in order to help sickle cell patients in Cameroon, saying that the diaspora can also help with expertise in actually vetting projects that are not sustainable back home in Cameroon. Not every time that someone comes and wants to do good is something that is going to end up being good. Because if you transplant sickle cell patients and bring them back to Cameroon without a platform to actually take care of them, majority of them would die of the transplant complications than from the sickle cell. So I think that's just putting a bit of meat into what she's doing in Cameroon. So thank you.
Yeah, thanks, Bono. That was reminds me, I need to connect with Dr. Stéphane Biheng from France, who is currently here on the call. I think he's doing some work on sickle cell in Cameroon, and I think after the town hall, I'll probably connect you with him, doing some really impressive stuff. I want to take one last round of questions since we are almost at the hour. Dr. Edwin, I see your hand is still up. If you have another contribution or question to ask. Edwin?
Yeah, sure. I mean, great. I think my thoughts on the goals as a day is sometimes I see goals as a way, especially as we collaborate with the ministry, to kind of have buy-in from everybody, especially across ministries. So if one of our key issues that we had raised was challenges meeting leadership at the level of the ministry, maybe we could start by see if we can agree from their perspective that, okay, people who come to see them, maybe at the end of the 2 years, maybe 20% of the people will be seen, right? So then it begins to give some teeth into what the original challenges that we face. Or maybe at the end of 2024, could we at least agree with the Ministry of External Relations that people who seek visas, at the minimum, maybe 50% of those going to Cameroon for health missions would be granted access. So I think those are little things that will easily, everybody can wrap their hands around, and we can always go back to say, hey, remember both of us, we agreed on this deal to say we want to accomplish this. How are we doing with that? I think that, to me, that is where I see the town hall really helping to strategize, to start having, because when you are dealing with ministries in Cameroon, like everybody says, it can be very tricky. But we also know that having those, besides individual goals, having those global goals of the original challenges can really help move things forward. So that even if the minister, God forbid, knowing how things change in Cameroon is not there, we can always come to the next minister and say, hey, Mr. Minister, this is what we had agreed with the last person, and see, can you buy into this idea? Do you buy into this as a goal that we had set, so that we continue to work on it as a group? Again, just some thoughts on some of the short-term goals.
Yeah, thanks a lot, Aroke, for expanding on that as well. I completely resonate with all the points that you've made. I think it's absolutely crucial as we think about this project moving onwards. Maloba, if you could ask your question in just a few seconds so we can
please. I think I have a recommendation or some sort of suggestions too. First of all, talking about humility, I think that the diaspora, they are humble people. But the truth is, sometimes those in Cameroon may not want to accept that. And those are things that we don't want to say it. For instance, I was working in Cameroon 2009. I was posted to the north. I was very young by then. Guess what those people told me? Who are you to come and be a leader? Where did you learn? When did you learn? Are you not sent by Pobia? And it was a total chaos, just to accept me. So sometimes it's not only the issue of diasporans, it's also us who are the problem. So I think that sensibilization is very important. We should not just go there and think that this guy will accept it. Because you living from the diaspora going there, some of them are thinking that you have come to take their position. And like a friend got a job in Cameroon, a good paying job, they told him don't go because they can easily kill you because you are going to take someone gombo. And that guy was afraid to go. So sometimes I think that in our project or our programs, we need to put a lot of sensibilization of these different structures through a platform to educate the people on the importance of these things. We should not just think that they will accept it because it's coming from the diaspora or because we are expert, things like that. Second thing I have is that, for instance, I've written a project on malaria. I'm working with Sancho Pasteur. I'm looking actually for a student in Cameroon who has a good knowledge in immunology to execute that. I think I've been struggling to get a student. I'm asking if in case the town hall can create a platform where they can also look into institution, because some of their students out there who are looking for projects like this to actually execute to get their master's or PhD. How can this town hall create a liaison with some of these institutions where they can be linked to researchers abroad, to the diaspora, and even those in Cameroon? So I think that we should not just focus on project, we should also focus on empowering, building capacity for these students and things like that. So I think that that's something that the town hall can look into, and then also sensibilization for the people.
Yeah, thanks a lot. It's something I think the town hall the background has been doing, linking up people with projects and in different ways. So capacity building has been a very integral component of this. So for sure, there are certainly ways.
Yeah, please, if anybody has a master's student, I'll be happy to work with. They can link to me, please. A master's in immunology, please.
Sure.
Yeah, I'll be happy. Yeah, thank you.
So, yeah, we can connect after this. Yeah, so I just wanted to make a last round with the moderators. I think it's been a great discussion. Lots of insights has been shared here today. So I just wanted to, as we wrap up this this discussion, take a last round with the moderators. I'll start with Dr. Kate.
Sorry, I was looking for my mute button. I think this working group, I mean, thank you so much, Dr. Sammuel, Dr. Mono, Elvis, for the feedback from this meeting. I think the discussions today have been rich. And I believe that we are, I think this town hall is suffering from its success, which is a good thing. And we hope that, you know, going forward, this platform is really going to be beneficial, not only for the diasporans, but, you know, also for Cameroonians living in the country. And it's not just going to be another working group or another committee. There's something I read in a book written by one author called Felix Dennis. He said something about committees, that a committee is a group of the unwilling, choosing from the unfit to do the unnecessary. Just so, and they do it so brilliantly well, whether in a college dorm or in a walnut panel boardroom of an international conglomerate or around your kitchen table. I believe this working group is not going to, you know, honor the definition of this committee that Felix Dennis wrote in his book, How to Get Rich. And it's not going to be just another working group like all the other working groups and committees that we have in Cameroon. Thank you.
Thanks a lot, Kate. Always great insights from you. Elvis.
Yeah, thank you very much, Dr. Brian, for your excellent moderation of this session. And I want to take the opportunity to thank all our participants of the town hall, to say that if there is any one organization I've ever belonged to where I have seen a high level of respect in the way we conduct our conversation, the town hall is one of them. And I really appreciate everybody that is able to speak in the town hall. And just know that there is never a useless idea. There is never a wrong idea. All ideas are important. And so we really thank everyone that takes the opportunity to speak in the town hall. We really appreciate all your inputs and contribution. I want to thank all those who contributed today. And I want to also thank our members of the working group. We have Gladys Happy, who has been busy at work today, but I know she was able to join and listen. Thank you for your service. She's one of those who goes back home very regularly for a medical mission and is part of those that were appointed to that working group. I want to thank Dr. Sammuel and Professor Ngacho for all the hard work you've put in for this very short time. As I say, the dream is big. Let's keep it simple and do the little we can do one step at a time. The problems are always so many, but let's always identify one problem, solve it, and then we make a giant step of looking for the next problem to solve. Thank you so much, and you always hear from us when we have important communications by email. I hope you always. I saw the response rate of our email last time. I was very thrilled. We sent out the email telling you about the creation of the working group, and out of the 2,100 people that received the email in the very first 3 hours of sending the email, 700 people had read their emails from the statistics I get from the back end. That shows just the interest you show each time you see an email from the town hall, and I want to appreciate you for that. And I want to appreciate all those who take time to send a reply to our emails. We always read all those replies, and we try to reply to some of you. We always read all the emails, and we try to reply to some. We cannot reply to all, but just know that your emails are being read. Thank you so much.
Yeah, thanks a lot, Elvis. I just one last round with the working group members. Dr. Sammuel, I don't know if Larissa Happy is able to speak, and also Professor Ngachu, if there are any last and Dr. Mono, if there are any last remarks or comments you wanted to make.
I can speak.
I just want to start with Larissa. Please, welcome.
Hi, how are you? Thank you, guys. I've been listening off and on. Like I said, I'm in primary care today. I actually saw my last patient at 1, but the documentation is pretty intense, like it is in primary care. Yeah, I heard some of the comments, and I agree with my colleagues about what we can bring to Cameroon, because I've had people reach out to me asking me if folks from Europe were included in this, and as well as Canada. And I told them, this is going to be an all-inclusive thing. In addition, I know somebody mentioned the nursing groups. Yes, there are nursing groups in Cameroon. Actually, they have several. They're pretty active. I'm in touch with them, as I've worked with different nursing schools, especially during the cholera outbreak in the Southwest region. Yes, and I can provide that information. There's actually in every region in Cameroon, they have very organized nursing groups. The other thing was, what was I going to add? I think you guys say pretty much everything I was going to say. I was listening, but I couldn't just chime in every time. Something else Dr. Muno mentioned, I can't recall it at this time. And the other rapporteurs were like very much in line with what I was going to say, as far as like what we want to do in Cameroon. It's just like, it's not about talking about the problem, more like bringing solution, which is like one of the things I love, because one of my background is actually management. I did work as a nursing manager in a couple of institutions here in the US for a long time. So I'm more like a problem solving person. So that's something I like to do. And as I was telling one of my colleagues, they were saying, oh, why are you guys doing this? Are you guys getting paid by the government? Are you this? And I say, well, remember what Kennedy said, like, ask not what your country did for you, but what have you done for your country? And I told them that's our motto. We're not doing this for any money. We're just doing it like just like any diasporan who has left and want to make a change and bring back what they've learned abroad. I don't know why I have so many people, quite a few people questioning some of our agenda, thinking that we're being paid, but it's the majority at least sees this as a positive thing. So yeah, that's all I have to say. Thank you.
Yeah, thanks a lot, Happy, and again, thanks a lot for your dedication to this project as well, moving forward, and all the inputs that you've made as well. So really, really much gratitude to you. Please, Prof. Songachu, any last remarks?
Yeah, thanks, Brian. My point, I saw a question on the chat made by one attendee asking, will members from Cameroon be included in this platform? And I think that is a very important point, because if the platform is meant to match between diaspora and Cameroon, it might be worth also knowing what the people in Cameroon need. And if they are not part of the platform, we might not know. We might only know what the government needs. So I think that is a very important point. And probably it will be good that we take that point forward to the next meeting. So I cannot remember who made that question, but that I think, yes, I think it's Crespo. Yes. So I think I will take that point to the next meeting if I attend. If not, I will try and make sure that that point is presented. Regarding a roundup, I think I will put it this way. It is very important that those of us attending this meeting know that the Cameroon political system is recognizing the importance of its diaspora. And that diaspora is not only in the health sector, but that importance of the diaspora is in every aspect of Cameroon. And here we are actually representing the health diaspora, and we should not ignore this call. I think we as diasporas, we are here to contribute to the development of Cameroon, and I think we should seize this opportunity and make the most of it, because we will all benefit from it one day, either personally, physically, or psychologically. So let's give it our best shot. Thank you.
I see. Thanks a lot, Prof. Really appreciate it. Dr. Sammuel.
Oh, can you hear me?
Yes.
Sorry, I just switched to my car. I had to step out of the house. I want to say the closing remark by Professor Ngachu is exactly what was in my mind. And I want to say this is really the first step for us and this opportunity that we have. And when I said talking about humility, I believe that for the longest time, many of us have been looking for an opportunity to connect with our government to be able to do something back home. And like our sister Gladys said, it is not the government requesting for us to come back. It is through the town hall, and they, like Professor Ngachu said, they have seen also our interest through the town hall and many others, our cries in the past of trying to come back home to do something. And now we have the opportunity. And I just wanted to close by encouraging, just like Dr. Maluba was saying, there are many who have recommendations just like him. And we heard Elvis mention the number of responses he got. And I want to encourage others, if you have just recommendation, especially for those of us who are in the working group, as I say, please, you can send us that written recommendation. Sometimes having it in written form is also very helpful. And you can reach us through the town hall. I mean, the email that Elvis has, if there are recommendations directed to the working group, that will be very helpful. So I just want to thank the town hall again for this opportunity, and we will continue to represent you, and we will continue to take your recommendations to the working group. Thank you.
Thank you so much, Dr. Sammuel. Appreciate your comments. Dr. Mono, please.
Well, Kate, thank you very much. I just want to make two comments. That this is a very inclusive group, meaning that we actually, before creating this group, reached out to multiple organizations, even in Europe. And the minister initially just wanted 4 candidates. I was inserted as a candidate in the case where there was no one else that was showing up. We were still waiting for representatives from France, and we're waiting for representatives from Germany. So we do have the UK and represented here, and we have the US represented, which is representing all of North America. And during our last meeting and after meeting, you know, most of the discussions do occur after the meeting itself. We reached out to the minister and the Secretary General about still being open for us to receive a representative from the French medical professional organization so that they can sit on the table. I believe that real. And also those in Germany are doing a lot. So we advocated for 2 more seats for them. And it's a tenure for 2 years, and people will leave and others will be put into that position. So I'm just saying this so that everyone should know, no one is being paid to be there. We want people who would sacrifice their times and attend these meetings and show up for the meetings and give us reports. And I want to use this opportunity to really thank Sammuel for his dedication. I cannot tell you how much he has been pushed for in getting this done. So I would take one of his comments that struck me today is really that instead of us complaining, we should make suggestions as diasporans. Instead of us looking for culprits and blaming people, we should be the solution to the problems going forward. Instead of playing the victim, we should be in the process of striving to become winners so that Cameroon can progress. Instead of us actually justifying our mistakes, we should learn from them. And instead of us being in the position of having attitude, we should learn to collaborate with those who are back home. The reason at times those who are back home do not want to talk to us on the phone and everything, they feel each time we're calling in order to tell them what to do, not to actually collaborate. And those back home should be able to also collaborate with us. They should not create an environment of resistance. So we should work together. That's just going to be my message, Brian. Let's work together.
Yeah, thanks a lot, Dr. Mono, for your closing remarks as well. I just wanted to end by, and just remember that we have a parking lot after this, so we can discuss off recording. I just want to recognize the presence of Professor Shea Wisonge, who has really been a great mentor and support as well for the town hall, and wanted to, if he would be willing to share some his comments on this, any last words from him regarding this this initiative and ways that we could maximize impact using this this platform that the this opening that the Ministry of Public Health has made to enable the diaspora to have more an impact, more of things to do in Cameroon. Professor Wisonge.
Thank you for putting me on the spot. No, I thank you for this great initiative. I think it's difficult not to be a part of a good initiative, and I think I join you in this, and I encourage everybody to do the same. And let's not complain. Let's suggest how we can improve it. Thank you.
No, thanks. Thank you so much, Professor Wisonge. So I think that's the end for the town hall. I will pass it over to Elvis. Elvis, over to you.
Yeah, thank you, everybody. Brian, you did a good job. And as always, it's a good time spending together with all of you. Hopefully, we will see you in a fortnight with a very interesting presentation that is going to be on hepatitis. Mono, am I correct?
Yes, I think so. I hope so.
We're going to have a very interesting session. You shall get the invite, and it's going to be from one of the best of the experts that will be able to drill us on the importance of paying attention to the high prevalence of hepatitis B and C in Cameroon. So thank you. It was a nice time spent together. I wish you a very excellent weekend, and see you in a fortnight.